My name is Aya Zayadne. My assignment about Helicobacter pylori and the human papillomavirus. Let's start with Helicobacter pylori. Previously known as Campylobacter pylori, it's a gram-negative, is a small curved microaerofollicular shaped bacteria, and this is the shape of Helicobacter pylori. For epidemiology, about 2/3 of the world population is infected, but it's more common in developing countries. A long-stay traveler may at higher risk than short-term traveler. The most likely mode of transmission is from person to person by either oral or facial oral route. Incidence of H. pylori infection appears to be higher in children than in adults due to lower standard of personal hygiene in younger population. For a clinical manifestation, usually H. pylori asymptomatic, but it's the major cause of peptic ulcer disease and gastritis worldwide. These common symptoms include nausea, vomiting, or loss of appetite can be appeared. And also, H. pylori is the major cause of gastric cancer and mucosal associated lymphoid lymphoma. And infected people have 2 times to 6 times increased risk of developing gastric cancer and mucosal associated lymphoid lymphoma compared with unaffected counterparts. For prevention and treatment, asymptomatic infection don't need to be treated, but patients with active duodenal or gastric ulcer should be treated. And the standard treatment for these symptoms that can cause by H. pylori is bismuth bladder therapy, include proton pump inhibitors or H2 blocker plus bismuth with metronidazole and tetracycline. The second choice of treatment is clarithromycin triple therapy, proton pump inhibitors with clarithromycin and amoxicillin or metronidazole. And this treatment can be used in regions where H. pylori clarithromycin resistance is known to be less than 15%. For human papillomavirus, it's a small DNA virus. It's most common scheduled transmitted infection. Most human papillomavirus type infect the cutaneous epithelium and can cause common skin warts. More than 200 distinct types have been identified. The most common high-risk type are 16 and 18 type for human papillomavirus and are considered to be responsible for more than 70% of all cervical cancer cases. For epidemiology, human papillomavirus transmitted to intimate skin-to-skin contact with an infected person. Transmission is most common during vaginal, anal, or oral sex. The worldwide prevalence of infection with the human papillomavirus in women without cervical abnormality is 11 to 12%, with higher rate in Africa 24%, Eastern Europe 21%, and Latin America 16%. The two most prevalent type is 16 and 18 type of human papillomavirus. The prevalence of human papillomavirus 16 is 3.2% and the 18 1.4%. Prevalence increased in women with cervical pathology in proportion to the severity of the lesion reaching about around 90%. Also, most scheduled active adults will have a human papillomavirus infection. For a clinical manifestation, most human papillomavirus infection are asymptomatic and result in no clinical disease. But clinical manifestation of a human papillomavirus infection include anogenital warts, recurrent respiratory papillomatosis, cervical cancer precursors, and cancer include anal, vaginal, penile, and oropharyngeal cancer. For prevention and treatment, no specific treatment is required for or recommended for asymptomatic human papillomavirus infection, but medical management is recommended for treatment of specific clinical manifestation, human papillomavirus disease such as anogenital warts, cancers, and so on. Vaccination prevents human papillomavirus infection, benefiting both vaccinated person and their future sex partner by preventing spread of human papillomavirus. But human papillomavirus transmission can be reduced but not eliminated. Again, about prevention and treatment, genital warts can be treated by your healthcare provider or with prescription medication. If left untreated, and genital warts will grow in size and number. Cervical precancer can be treated also. Women who get routine pap tests and follow up as needed can identify problem before cancer develop. As we know that prevention is also always better than treatment. Other human papillomavirus related cancer also more treatable when diagnosed and treated early. Here we have the human papillomavirus vaccines, 3 of the human papillomavirus vaccines. First one is the Cervarix, the cervix is the bivalent human papillomavirus, and the second one, Gardasil and Gardasil 9, are bivalent human papillomavirus vaccines and 9-valent human papillomavirus vaccines. All of these protect against the majority of cervical cancer, and 4 and 9 protect against the majority of genital warts. Only nine vaccine is available in the United States. Limiting the number of sex partner can reduce the risk of for human papillomavirus. Even person with only one lifetime sex partner can get human papillomavirus. So abstating from sexual activity is a more reliable method for preventing genital human papillomavirus infection. And thank you.